Now, this diagram is the coronal section of which particular part of the perineum? That also male perineum. Okay. Now here you can see two perineal pouches are there. Can anyone identify the superficial and deep perineal pouches? Yes. So this is the superficial perineal pouch and this is the deep perineal pouch. Okay. So in the last class we have discussed what is superficial perineal pouch, what is deep perineal pouch, and I hope you remember I have drawn the diagram and I have shown you that two triangles are there in the perineal region, right? What are those two triangles? Urogenital triangle and anal triangle. In an urogenital triangle, we are having two pouches, superficial and deep perineal pouches, right? Now, those are pouches, not cavities. So, there are some areas where it is open. So, what exactly you have to know? This is very important. You will be getting questions in the upcoming exam from these superficial and deep perineal pouches. Okay, write about the boundaries, contents of the pouches, and along with that, we'll be discussing the applied importance also. So, in case of superficial and deep perineal pouch, what you have to know is the boundary. Okay, so what is the superficial boundary? What is the deep boundary? What is present on both the sides? That is lateral boundaries, anterior and posterior. Along with that, you have to know the contents. For that, the most important part is knowing the diagram. Okay, if you know the diagram, directly you can write the boundaries and the contents. Another important point, in case of perineum, please keep that in mind whenever you are writing about the superficial and deep perineal pouches, you have to write it separately for male and female. Now, this is male or female. Which perineal pouch is this? Male or female? Male. Okay. So please note it down. During the time of exam, whenever you are writing about the perineal pouches, the boundaries, after that the contents, at that time you have to mention separately. Okay, what is for male and what is for female. Okay, that is very important. So this is the superficial perineal pouch, and here you can see this is the superficial and deep perineal pouch, but this is for female. Okay, so up to that much I know we have discussed in the last class. Please practice all those things. These are very important. Okay. Now, if you remember, that day we have discussed that this is the urogenital triangle and this is the anal triangle. Okay. Now, in case of urogenital triangle, we have studied that perineal pouches are there. Superficial perineal pouch and deep perineal pouch. Now, can anyone tell me this superficial and deep perineal pouch are separated by what? Just now I have shown you the diagram. By perineal membrane. Triangular shaped perineal membrane. Separating the superficial and deep perineal pouch. Right? Now, there are different structures piercing the membrane. Again, for male and female, it is different. Okay, so these are important points which I am highlighting. Please go through it. Now, this particular part is over where we have studied the superficial and deep perineal pouch. Okay, now this is, if you remember, this is the boundary of the perineum, deep boundary of the perineum. Okay, now come to this particular part, the lower part. This is called the anal triangle. Now in anal triangle, exactly what we have to study? We have to study the ischioanal fossa. We have to study the ischioanal fossa. Okay. So pouches are done. Next, what is left? In the anal triangle, we have to study about the ischioanal fossae. So why I have written fossae? That means it is two, not one. If it is one, then it will be fossa. Fossae means more than one. So two ischioanal fossae are present. Now the question is why these fossa are there, or two fossae are present, and where they are present, and what is their function? Because this particular ischioanal fossa is very important from the applied perspective. Okay, so we'll see about the ischioanal fossa. Okay, so what exactly is this ischioanal fossa and where it is present? So this ischioanal fossa is also called as ischiorectal fossae, and they are situated on each side of the anal canal. Okay, the terminal part of the anal canal, on the each side of the terminal part of the anal canal, these fossae are there. Okay, as you can see, on each side of the anal canal, fascia line wedge-shaped spaces are there. Fascia line wedge-shaped spaces are there, and that is called as ischioanal fossa. And where it is situated? It is situated between the skin of the perineum and the pelvic diaphragm. Skin of the perineum and the pelvic diaphragm. In between that, these ischioanal fossae are present. So, and they are present on either side of the terminal part of anal canal. Okay. Now the question is why this fossae is present. Now mainly these fossae contain fat. Okay, chambers of fat are also called as fat loculi. Now they are present so that whenever the stool is passing during the time of defecation through anal canal, the stool is passing. So whenever the stool is passing, at that time the anal canal distends. Okay, so for distance in the space which is required, that space is provided by the ischioanal fossa. Is it clear? That's why the ischioanal fossae are present on either side. Okay. Next, you can see it is wedge-shaped space, and that also it is lined by various fascia. Wedge-shaped space. Now, if it is wedge, do you know the meaning of wedge shape? Wedge shape meaning is whenever you are taking the whenever you are taking any cross section, if it is triangular in shape, then it is called the wedge shape. Okay. Now, if it is wedge shaped, it is having apex, it is having base. Okay. Then it is having anterior boundary, posterior boundary, lateral boundary, and medial boundary. Okay. These are the various boundaries. Now, let me show you the diagram. Yeah. So here you can see the boundaries. So I was talking about this particular area. Okay. This is the ischioanal fossa. So in this side also one ischioanal fossa is there, and this side also one fossa is there. Now can you see the anal canal? So this is the terminal part of the anal canal. Okay, now here you can see it is fascia lined space. Inside that what is present? Fat loculi or fat chambers are present. Now this is the apex, you can see this is the apex. Here you can see this is the base. After that this is the lateral wall. This is the medial wall. Okay, and if you go anteriorly, then we are having the perineal membrane, and if you go posteriorly, gluteus maximus is there along with the sacrotuberous ligament. Okay. Now, if you see the apex, can you see the apex? So you can see it is mainly made up of the adjoining of two fasciae of the obturator internus and inferior pelvic fascia. Okay, that is forming the apex. Next, you can see the lateral wall. Lateral wall, it is mainly formed by the ischial tuberosity. Medially, it is formed by the external anal sphincter. Okay, at the terminal part of the anal canal, sphincters are there. So this is forming the medial wall. Now, base is mainly formed by the skin. Base is mainly formed by the skin. Okay, of the anal triangle. Now, so inside this you can see only fat or fatty tissue is present. Okay, along with that, few important nerves are also situated. Okay, now as I said, whenever the stool is passing during the time of defecation, at that time this will expand. Okay, so for that the area which is required, that is provided by the ischioanal fossa. Okay, next on the lateral wall of the ischioanal fossa, can you see this particular thing on the lateral wall? This is called as pudendal canal. This is called as pudendal canal. It's a facial canal, very important. Okay, and it is also having a important applied part. Okay, so what is pudendal canal and what is the importance, that also we'll discuss. Here I am showing you what is the location of the pudendal canal. Now, what is the content? So the ischioanal fossa which is there, inside that what is the content? As I said, mainly it is filled by fat. Now, fat bodies which are there, it is traversed by fibrous band as well as several neurovascular structure. Among them, we are having the anal and rectal vessels, cutaneous nerves, mainly the branches of S2, S3 and perineal branch of the S4 nerve. Okay, these are the main nerves which are passing through the ischioanal fossa, and along with that, anal and rectal vessels are also present. Okay. Next, the ischioanal fossa which is there. Okay, as I said, it is a fascia covered space, wedge shaped. Now there are some extension from those spaces. Okay, and these are called as recesses of the fossa. These are called as recesses of the fossa. So mainly three recesses are there: anterior recess, posterior recess, and horseshoe shaped recess. Okay, that means the spaces which are there beyond their boundaries, they are extended. So they are extended in the anterior direction, they are extended posteriorly, and they are extended horseshoe shape. Horseshoe shape, it means on both the side they are connected to each other behind the anal canal. That is the horseshoe shaped recess. Okay. So as you can see, the anterior recess extends forward above the perineal membrane, and it is reaching up to the posterior aspect of the body of the pubis. Okay, so beyond apex, that is the anterior recess. Next, posteriorly, it extends deep to the sacrotuberous ligament. As you can see, this is the sacrotuberous ligament. Posteriorly, it is extending deep to the sacrotuberous ligament. And horseshoe recess means connects to ischioanal fossa behind the anal canal. Okay, so two fossae are there on both the side. In the middle, anal canal is there, so both are connected posteriorly behind the anal canal. Okay, that is the horseshoe shaped recess which you can see over here. Okay, so these are some extensions of the recess. Next is the pudendal canal. So just now I have shown you what is the location of the pudendal canal inside the ischioanal fossa on the lateral wall. Okay, so what exactly is this pudendal canal? Okay, and why we are focusing on this particular pudendal canal? Because if you see, the pudendal canal is also called as Alcock canal. It is an essential horizontal passageway through which various nerves and blood vessels are passing, and it is mainly formed by the obturator internus fascia. Okay, obturator internus, a muscle is there. The fascia which is covering the obturator internus muscle, it is forming that particular canal. Okay, that also on the lateral wall of ischioanal fossa. So as you can see, passageway within the obturator fascia covers the medial aspect of the obturator internus, and it is lying on the lateral wall of the ischioanal fossa. Okay. Now, through this particular canal, the important structures which are passing, as you can see, these are the internal pudendal artery, vein, pudendal nerve. These are the structures which are passing through it. Okay. Now, why it is important? Because these internal pudendal vessels and nerve, they supply and drain and innervate most of the perineum. Okay, so most of the perineal area is supplied by these blood vessels, and they are innervated by these nerves, which you can see over here. Okay. Now, based on this, we'll discuss some important applied part of this perineum as well as the pudendal canal also. Now, the ischioanal fossa and the perineum, they are common sites for abscess. Formation of abscess, the common sites are this perineum and the ischioanal fossa. Okay. Now, once the abscess are formed, after that what happens? Sometimes the abscess may burst. Now, after bursting, it may go into the anal canal or into the rectum internally or onto the surface of the perineum. Okay. In this way, a fistula is formed, and that is called as anal fistula or fistulo-ano. Have you heard about fistula? Anyone? What is this fistula? See, fistula is a abnormal connection between two tubular structure or a cavity to the exterior where it will be connecting to the skin or between the two organs. Abnormal connection. It is not normal. Okay. And this fistula, most commonly occurring area where the fistula are present, that is nothing but the perineum and the ischioanal fossa. Okay. Because first the abscess formation will be there, and it may rupture. Once it rupture, at that time the chances of formation of the fistula are very common. Okay. Now, anal fistula result from spread of an anal infection. Okay. Now, one end of this abnormal canal opens into the anal canal and another into the skin of the perineal region. So once the anal fistula is formed, one particular connection will be in the anal canal, another connection will be in the skin of the perineal region. Okay, that is the abnormal connection which is formed after the bursting of the abscess. That is called the anal fistula. Let me show you the diagram. Yeah. So in this diagram, you can see the abscess is formed. Once the abscess is formed, if it bursts, and then you can see the fistula is formed. The first, the abscess is formed, collection of fluid. Okay. Then gradually it can convert into the fistula. Now, once it is converted into the fistula, you can see this is the interior of the anal canal. It is connected, and then it is coming into the perianal skin. Okay. Now, what do you think? What will happen? Now, if a person, suppose if a person is suffering from anal fistula, okay, when you will examine the skin of the perineal region, at that time you will see that the coloration of the skin has changed. Okay, pain will be there, swelling, tenderness, all those things will be there, and along with that, discharge will be there, which will be very smelly in nature. Smelly discharge will take place through that opening. Okay, because see, whenever stool will pass through the anal canal, okay, the chances of coming of stool from this particular part is also there. So at that time, what will happen? Discharge will be there, which is smelly in nature. Along with that, pass will also come along with the discharge. Okay, so these are some symptoms which you will observe when a person is suffering from anal fistula. Correct? Now, there are different diagnoses of this anal fistula. Okay, among them, one of the common technique by which the fistula can be diagnosed, that is called as fistulogram. It is called as fistulogram. So during this fistulogram, what is done? The area where the fistula is connected with the skin, that particular area is cleaned, sterilized, and then radiopaque contrast media are injected. Okay, and after that, X-rays are taken. So what will happen when the contrast media will flow through that particular channel, flow through that particular fistula? At that time, the depth of the fistula, or if any branches are there of the fistula, that can be diagnosed, and which part is particularly connected. Okay, whether it is rectum or whether it is anal canal, that can also be diagnosed. Okay, and it is commonly practiced, the fistulogram. So let me show you an image here. So here you can see this is the X-ray image of fistulogram. Okay. Now in this case, when a person is suffering from fistula, at that time what is done? You can see the with the help of the syringe, radiopaque contrast media is injected, and this is around the perineal skin. Okay. Now what will happen once the contrast media is injected? It will flow through the passage. It will flow through the fistula, and then it will show you the connection, whether it is connected to which part of the rectum or anal canal. So during that time, the X-rays are taken so that it can be diagnosed. There are some cases where the fistula which is there, it is having some branches also. Okay, that can also be diagnosed with the help of this X-ray fistulogram. Okay, there are other examinations also, but this is the easiest way to diagnose the fistula, means exact connections of the fistula. Okay, then the extravasation of the urine is taking place. I hope you have studied about the urethra, male urethra. Previous classes you have studied about the male urethra, right? So when you have studied the male urethra, can anyone tell me what are the parts of the male urethra? What are the parts of male urethra? Prostatic part is there, membranous part is there, and penile part is there. Okay, mainly three parts are there of the urethra. See why I am asking? Because if you don't understand the parts of the male urethra, you will not understand the superficial extravasation and deep extravasation. Okay, superficial extravasation takes place when there is injury in the penile part of the urethra. Okay, and deep is taking place when the injury is in the membranous part of the urethra. Okay, now the question is how the injury can take place in the urethra. Any idea? In male urethra, how the injury can take place? Trauma or accident, you can say. In accidental case, the injury can take place. Another important cause is there, by which there may be chances of rupture of the urethra. That is by doing cystoscopy or other interventional procedure. Okay, in cystoscopy, what happened? Same like I hope you have heard about endoscopy. So similarly in cystoscopy is inserted through the urethra up to the bladder to see the interior of the bladder. Okay, at that time there are chances of getting rupture of the urethra. Okay, now once the urethra is ruptured, then what will happen? Think, if the rupture is there in the urethra, what will happen? What do you think? There will be extravasation of the urine. That means leakage of the urine. Okay, into the various part. Now that leakage of the urine, okay, is going in various direction, but it is unable to go into the lower part of the thigh. Why? Because of the attachment of Pullis fascia. Okay, that is the main reason of knowing the extravasation of the urine. Okay, and in two places it is taking place, superficial and deep. So in superficial extravasation means when the leakage is taking place, at that time what happened? The spread of the urine is downwards deep to the membranous layer, okay, of the superficial fascia. First it will fill the superficial perineal space, then scrotum, penis and the lower abdominal wall. These are the areas where urine can go and it can spread, but it is prevented from going into the ischioanal fossa or into the thigh by the firm attachment of the membranous part of the superficial fascia, that is the Pullis fascia. Okay, as you can see, it is prevented from going into the ischioanal fossa or the thigh by the firm attachment of the membranous part of the superficial fascia, also called as the Pullis fascia, which will prevent the extravasation of the urine into the lower part of the thigh. Okay. Next, in deep extravasation, what happens? The spread is into the extraperitoneal space, pelvis, around the bladder, prostate, and into the anterior abdominal wall. These are the areas, okay, in which the extravasation is taking place during the rupture of the urethra. That also especially in the membranous part of the urethra. Okay. Okay. Next, have you heard about episiotomy? Anyone? You have not heard about episiotomy? Yes? Okay. So what is episiotomy? Now, so episiotomy is a surgical incision of the perineum and infero-posterior vaginal wall, which is done to enlarge the vaginal wall during the time of parturition. Okay? That is the episiotomy. So as you can see, episiotomy is a surgical incision of the perineum and infero-posterior vaginal wall. Why it is done? To enlarge the vaginal orifice or the opening, to decrease the excessive traumatic tearing of the perineum, okay, and the perineal muscles during the time of parturition. The incision is taken. Okay. Now, when the incision is taken, different types of incisions are there. As you can see, the median episiotomy is there and mediolateral episiotomy is there. Okay, so different incisions are taken. Why? In order to widen the vaginal orifice for normal parturition. Now the episiotomy, if it is in the midline, then it is called median episiotomy. Okay, which begins near the center of the perineum and extends straight downwards, and mediolateral, which starts nearly 60° to the side. Okay, that means in the median plane. Now, there are different types of episiotomy, for example, J-shaped, lateral, anterior, etc. Okay. Now, another type of episiotomy is there. Now, if the incision in the median episiotomy, if the incision starts at the frenulum of the labia, runs along the midline through the central tendon of the perineal body, okay, then it is called as median episiotomy. Okay. Now, in this case, what happens? There may be chances of damage of the perineal body, because we have discussed that perineal body is situated at the center of the. Where is the perineal body situated? In the last class, we have discussed 10 muscles are attached into the perineal body, which is anchoring the pelvic floor. Center of the pelvic cavity, it is situated, anchoring the pelvic floor. Okay, so whenever the median incision is done, at that time there are chances of getting damage to the perineal body. Okay, if the perineal body is damaged, then what will happen? It will not be able to support the floor, pelvic floor. As a result, there may be chances of prolapse of different organs or different structures which are there in the pelvic cavity. Okay, so that's why the safe one is the lateral one, medial lateral episiotomy. Okay, now what happens? The incision begins at the midline of the frenulum. Okay, but it is directed laterally downwards at an angle of 60 degree. Okay, as you can see, the incision starts and then it is going laterally downwards. So this will avoid the anal sphincter and directed towards the ischial tuberosity. Okay, so the structure which can get damaged, that will be spared in case of the medial lateral episiotomy. Okay. Next, the last importance is the pudendal nerve block. So I have shown you the pudendal canal, right? And then inside the pudendal canal, we have seen the pudendal nerves and blood vessels are there. Now, during the time of episiotomy, okay, two options are there for giving the anesthesia. General is there and local is also there. Now, if a person don't want, or if the doctor don't want to give the general anesthesia, in that case, local anesthetics can be injected into the pudendal canal, and as you can see in the diagram. Okay, so the pudendal nerve supplies the sensory branch to the lower part of the vagina through the inferior rectal and posterior labial branches. Now, during the type of vaginal operation, general anesthesia can be replaced. How it is replaced? It can be replaced by the pudendal nerve block. Okay, now how it is given? The nerve is infiltrated near the ischial spine by a needle passed through the vaginal wall and then guided by a finger. As you can see, it is guided by a finger near the ischial spine through the vaginal opening, and then the anesthetic injection is given so that the part can be anesthetized, and then the surgery of the vagina can be done. Okay, and this procedure is called as pudendal nerve block. This is an alternative for general anesthesia. Okay, so these are some important applied aspects of the perineum which we have discussed. Okay, both in case of male and in female. So please go through it. Those are important, and during the time of exam, you can get questions from these particular topics. Okay, is a part of which system? Anyone? Female reproductive system. Okay, now in female reproductive system, mainly it is divided into two parts. As you can see over here, that is the female reproductive organs and female external genitalia. Two parts are there. So among them, as you can see, ovaries, uterine tubes, uterus and vagina, these are the reproductive organs, and here these are the external genitalia, which includes clitoris, labia majora, minora and great vestibular glands. Okay, so we'll start with the uterus. Okay, we'll start with the uterus. Why? Because in uterus there are lots of applied importance present. Okay, so today we will study the gross anatomy of the uterus, so that in the next class when I will discuss the applied importance, it will be easier for you to understand. Okay, so what is uterus? As you know, it is a pyriform shaped structure, childbearing organ in the female. Where it is situated? It is situated in the pelvis. Now, where in the pelvis? In between the bladder and the rectum. So anterior to the uterus, urinary bladder is there. Posterior to it, rectum is there. In between these two structures, the uterus is situated. Okay, it is hollow but thick-walled and firm. If you see the uterus, it is hollow but it is thick-walled and it is firm, and it can be palpated bimanually. Now, it is the organ which provide nutrition to a fertilized ovum, enabling it to grow into fully formed fetus, as you are studying in embryology. Now, at the time of childbirth, that is the parturition, the muscles which are there in the uterus helps in expulsion of the fetus through the birth canal. Okay, here you can see the location of the uterus situated in the pelvic cavity, in between what? In between the bladder and the rectum. Can you see the bladder? This is the bladder and this is the rectum. So in between these two, you can see the uterus is situated. Okay. Now, what is the shape of the uterus? It is pyriform shaped, also called as inverted pear shape. Here you can see the dimension: 7.5 centimeter long, 5 centimeter broad, and 2.5 centimeter thick. and the weight is approximately 30 to 40 gram. Now, if you see the uterus, mainly it is divided into two parts. The upper expanded part is called as the body, and lower cylindrical part is called as the cervix. Okay, as you can see in the diagram. So this upper expanded part is called as the body, lower cylindrical part is called as the cervix of the uterus. Okay, in between these two, a circular constriction is there, that is called the isthmus. Okay. Next, in the body, different parts are there that you have to know, and along with that, different surfaces, different borders are there that also you have to know, because those are having some important relations. Okay. Next, the superolateral angle of the body project outwards at the junction of the body and the fundus, and that is called as the pornua of the uterus. Okay. Superolateral angle just above the attachment of the fallopian tube, that particular areas, these are called as pornua of the uterus. Now, the uterine tube, ligament of ovary, and round ligament are attached to the lateral aspect of the uterus. Okay, so I was talking about this particular area, this lateral border. Okay, so in the lateral border, we are getting the attachment, first of all, the round ligament of the uterus, then the fallopian tube is attached, ligament of the ovary. Okay, these are attached to the lateral border. So these are the lateral borders of the uterus. Okay, next, if you see the body of the uterus, okay, if you see the body of the uterus, so uterus is having two surfaces, anterior surface and posterior surface. So this, whatever you can see over here, this is the anterior surface, and behind will be the posterior surface. Okay, anterior surface is also called as the vesical surface. Why? Because it is related to urinary bladder. Whenever you will hear the terminology vesicle, okay, please keep that in mind. It is related to urinary bladder. Okay, which is flat in nature. And posterior surface is called as intestinal surface, which is convex, and it is related to the coils of the ileum, terminal coils of the ileum. Okay. Okay. Next, this is a very important part, that is the normal position and angulation of the uterus. Okay. Now, what do you think? How the uterus is situated in the pelvic cavity? Whether it is straight? It is not straight. If you see the long axis of the vagina and if you see the long axis of the uterus, they are not straight. Okay, they are perpendicular to each other, like this, having 90-degree angle. Okay, so that is called as the angle, and the name of the angle is anteversion. As you can see, normally the axis of the uterus form an angle of 90 degree with the long axis of the vagina, and this forward tilting of the uterus relative to vagina is called as anteversion. Okay, this angulation is called as anteversion. Next, anteflexion is there. Backward tilting of the uterus relative to the vagina is called as retroversion, and the uterus, body of the uterus is slightly flexed at the level of the internal os, and that is called as anteflexion, and angulation is 125 degree. These particular positions are very important because they also provide a support to the uterus and prevents the prolapse of the uterus when the uterus is enlarged in size during the time of pregnancy. Okay, just imagine if the vagina and uterus is straight. Okay, then what will happen? The support which is provided to the uterus will be less, and there may be chances of prolapse of the uterus. That's why it is kept like this. Okay. Now, two angulations are there, as you can see in the diagram. So this is the long axis of the uterus, and you can see long axis of the vagina, which is 90 degree. This is called anteversion, angle of anteversion. Next, this is anteflexion, the long axis of the body and the cervix, mainly at the internal os, which is flexed, and it is forming the angulation of 125 degree. Okay, this is how the uterus is oriented. Okay, or it is positioned inside the pelvic cavity. Okay, this part is very important because this is also providing a support to the uterus. Okay, next, the parts of the uterus. So the uterus comprises, if you see the body, the upper expanded part, which is convex dome shaped, that is called as the fundus. Then two surfaces are the anterior surface, are also called as vesical surface. Why it is called as vesical surface? Related to urinary bladder. It is related to urinary bladder. and posterior on intestinal surface. Why intestinal? Because it is related to the coils of the intestine. That's why. Okay. Anterior surface is flat and posterior surface is convex in nature. Next, two lateral borders are there on the both the side. Two lateral borders are there, and below that you can see the cervix is present. Okay, so these are the parts of the uterus. Now, this already I have mentioned. The fundus is forming the upper part of the uterus, which is convex dome shaped. Okay. Now, there is a very important part which is related to the fundus. What is that? It is covered by the peritoneum and is directed forward when the bladder is empty. Okay. Inside the fundus, after fertilization, what is taking place? After fertilization, what happens? Implantation. Okay. So where the implantation is taking place? Mostly the implantation is taking place at the upper part of the uterus. That also on the fundus, posterior wall of the fundus. Okay, that's why fundus is important. Now, anterior or the vesical surface of the body is flat and it is related to the urinary bladder. Okay, now it is covered by peritoneum. So, the peritoneum which is covering the urinary bladder will go and cover the fundus of the uterus and it is forming the uterovesical pouch. Okay, so two pouches are there. First, the uterovesical pouch, and another pouch is there, which is called rectouterine pouch. So two pouches are there. Now these two pouches are very important because they are the dependent zone, and during the time of infection the fluid collection takes place in those pouches. Let me show you the pouch. Can you see the vesicouterine pouch? As you can see. So what is this? This is the urinary bladder. This is the urinary bladder, and here you can see this is the uterus. So the peritoneum which is lining like this will go into some part of the uterus and again it will be reflected. Okay, so this is forming a small pouch that is called as vesicouterine pouch. Vesico means urinary bladder, uterine means uterus. So it is in between these two, that's why it is called as vesicouterine pouch. Okay, so this is situated on the anterior aspect. Now if you go on the posterior aspect, here you can see another pouch is formed. It is called as rectouterine pouch. Okay, rectouterine pouch. That means between the rectum and the uterus. Okay, here also same peritoneal fold is there. So these are the dependent zone. And in those dependent zone, during the time of infection, the accumulation of fluid takes place. Okay, now this rectouterine pouch is also called as pouch of Douglas. Okay, if you have noticed the ultrasound report of abdomen, especially in case of female, okay, especially in case of female, when the ultrasound is done of the abdomen, entire abdomen, means abdomen with pelvic cavity, at that time they used to check whether fluid or pus collection is there or not in those particular pouches. Okay, and it is mentioned. I don't know whether you have seen any ultrasound report or not. If you have seen, you will see that all those things are mentioned in the ultrasound report. Okay, so that's why these pouches are important. Okay, next, posterior surface is convex related to the coils of the terminal ileum and sigmoid colon. Now here also a pouch is formed. It is called the rectouterine pouch, which I have shown you. Okay. Next is the lateral border, which is rounded and convex. Okay. Lateral border, two lateral borders are there, round and convex. Okay. Now this lateral border provides attachment to broad ligament of the uterus. Very important. Okay. So a ligament is there. This is nothing but the double layer fold of peritoneum. One end is attached to the lateral border of the uterus. Another end is attached to the lateral pelvic wall. In between these two folds, numerous structures are present. Okay. Along with that, the border gives attachment to the round ligament of the uterus, anterior inferior to the fallopian tube, and the ligament of the ovary, posterior inferior to the tube. So these are the attachment of the other structure as compared to the uterine tubes or the fallopian tube. Okay, the uterine artery is also ascending on the lateral aspect of the lateral border of the uterus. Okay, now see, I was talking about this lateral border. Now this lateral border is giving attachment to the broad ligament of the uterus. Now this broad ligament of uterus, what is this? It is a double layer fold of peritoneum. One end is attached to the lateral border, another end is attached to the lateral pelvic wall. Okay, so two layers are there, like these two layers. Now between the two layers, different structures are present, as you can see. Okay, different structures are present. Okay. Okay, next is the cervix of the uterus. So cervix of the uterus is the lowest part, cylindrical, most fixed part. The length is approximately 2.5 centimeter, and it is extending from internal os or internal orifice to the external orifice or ostium. Okay, that is the extent of the cervical canal. Now the lower part of the cervix, okay, this you have to know that the lower part of the cervix is protruding into the wall of the vagina and dividing the cervix into two parts, supravaginal part and the vaginal part. Okay. The lower part of the cervix projects into the anterior wall of the vagina, divides it into supravaginal and the vaginal part. Now if you take the supravaginal part just above the vagina, okay, at that time, posteriorly rectouterine pouch is there containing the coils of the intestine. On each side, ureter and uterine arteries are there. Okay. And the vaginal part of the cervix project into the anterior wall of the vagina. Let me show you the diagram. Okay. So here you can see this is the cervix. Now this cervix, what happens? It protrudes into the walls of the vagina. Okay. So it is forming the supravaginal part. So this is the supravaginal part and this is the vaginal part. Okay. Next, here you can see the extent of the cervical canal from the internal os to the external os. Okay. Next, when the cervix is protruding into the vaginal wall, so there is a gap between the cervix and the wall of the vagina, and these are called as fornices or fornix of the vagina. In this diagram, you can see. Okay. So this is the cervix, wall of the cervix extending into the vagina. So these particular areas which are there, these are called as fornices. Okay, it is more than one. That's why these are called as fornices of the vagina or the spaces. Okay, so in this diagram you can see the supravaginal part and the vaginal portion, and these are the fornices. Now I hope you have observed that the external os in case of multiparous and nulliparous women. Do you know what is multiparous and nulliparous? Multiparous means those who have given birth to more than one child. Those are called as multiparous women. And nulliparous means not given birth to any child. Okay, that is the multiparous and nulliparous. Now in case of multiparous and nulliparous, there are some changes. As you can see, the external os in case of nulliparous, it is circular. In case of multiparous, you can see it is in the form of anterior-posterior leak. Okay, so the after delivery of multiple child, the shape changes. Next, the contents of the broad ligament of the uterus. So the broad ligament of the uterus, which is there are various contents, or you can say various structures are present in the broad ligament of the uterus. Okay, so this is the list. Uterine tubes are there, round ligament of uterus, ligament of the ovary, uterine vessels, ovarian vessels, nerve plexus, lymph nodes, fibrofatty tissue. Okay, these are the various structures present. Next, there are three particular areas of the broad ligament of the uterus. What are they? It includes the mesoovarium, mesosalpinx and mesometrium. Okay. Now what is this mesoovarium? This is the part, posterior layer of the broad ligament of the uterus, which is attached to the ovary. That is the mesoovarium. Now the part of the broad ligament lying between the uterine tube and the ligament of the ovary, that is called as mesosalpinx. And below that, the area is called as mesometrium. Here you can see, so this is the broad ligament of the uterus. Okay, this is the broad ligament of the uterus. Now, here you can see this particular posterior layer which is attached to the ovary, that is called as mesoovarium. Okay, this is called as mesoovarium. Now this is the fallopian tube. Between the fallopian tube and the mesoovarium, this particular area which is present, it is called as mesosalpinx. Okay, and below that this particular area is called as mesoovarium. Okay, so these are the three areas of the broad ligament of the uterus. And in this diagram, you can see these are the different structures which are present in the broad ligament of the uterus. Okay. Next, the supports of the uterus. Okay, supports of the uterus. So as I said, the uterus which is there during the time of pregnancy, the size of the uterus enlarges enormously. Okay, so at that time it needs supports. So how those supports are provided to the uterus? For that, as you can see, the primary supports are there. The supports are divided into various categories. First, we will see the primary support. Okay, so in primary support, we are having the pelvic diaphragm, perineal body, and distal sphincter mechanism. Okay, distal urethral sphincter mechanism. These are the primary support. Now, last time I hope you remember we have discussed about the pelvic diaphragm. Two muscles are there forming the pelvic diaphragm. What are they? Levator ani and coccygeus muscle. Levator ani and coccygeus muscle. Okay, this pelvic diaphragm is a funnel shaped, and it is supporting the pelvic viscera or the organs which are present in the pelvic cavity. Right? So this particular pelvic diaphragm which is present, the pubococcygeus part of the pelvic diaphragm, okay, as you can see in the diagram, the pubococcygeus part of the pelvic diaphragm, it is forming a sling around the vagina, and it is also partially attached to the perineal body and thus providing support to the uterus. Next is the perineal body. So it is a fibromuscular node. Where it is situated? It is situated at the center of the pelvic cavity, and it is anchoring the pelvic diaphragm, and it is maintaining the integrity of the pelvic diaphragm also. Okay, so like this it is providing support. And just now we have discussed about the episiotomy, right? The incision which is taken, the median incision if you take, okay, and if it is damaging the perineal body, at that time what will happen? There will be chances of prolapse of the uterus. Okay, so that is the importance of the perineal body. Next, the distal urethral sphincter mechanism. Okay, so sphincter urethral mechanism is there. Two groups of muscles which are attached to the urethra and along with the terminal part of the urethra, and they are also connected with the vagina, and laterally they are attached to the pelvic wall. So like this they are also providing support to the vagina, which indirectly will provide support to the uterus. Okay, so these are the important supports of the uterus. Next, another type of supports are there. These are called as fibromuscular or mechanical support. In that we are having the uterine axis. Uterine axis means the positions of the uterus, which we have discussed just now. Anteversion and anteflexion. That is also providing support to the uterus. Next, pubocervical ligament, transverse cervical ligament of Mechendorff, which is also called as the cardinal ligament, and then uterosacral ligament and round ligament of the uterus. Okay. Now, these particular ligaments which I have mentioned, okay, they are nothing but the thickening of the endopelvic fascia, and they are providing support from anterior aspect, posterior aspect, and lateral aspect. Okay, let me show you the diagram. So this is the angulation which already we have discussed. This is also providing support to the uterus. Now, can you see this diagram? Here, this is the round ligament of the uterus, and you can see the uterosacral ligament. So this is providing support on which aspect? Anterior aspect. This particular round ligament is providing support on the anterior aspect. And here you can see uterosacral, which is attached to the sacrum. It is providing support on the posterior aspect. Okay. So anterior support is done, posterior support is done. What is left on the side, both the side? For that we are having the transverse ligament, or also called as ligament of Mechendorff. As you can see, so this is the transverse cervical ligament, which is fan-shaped condensation of the endopelvic fascia, which is at one end is attached to the lateral pelvic wall and another end is attached to the cervix. Okay, so pull of this particular ligaments from various aspects. It is providing support to the uterus. Okay. As you can see, this is the transverse cervical ligament. Okay, so this is how the supports are provided. Now additional supports are also there. As you can see, secondary supports. Okay, so they are having doubtful contribution, but still the supports are provided. Broad ligaments, vesicouterine pouch, rectovesical pouch. Okay, these are the folds of the peritoneum which are attached. They are also providing some support, but they are having doubtful function. Okay, so this is all about the supports of the uterus. Okay, further along with the applied importance we will discuss in the next class. Okay, so please note that the uterus is a uh, organ which needs blood supply, rich blood supply. That's why it is supplied by the uterine artery. Speciality of the uterine artery is that it is tortuous in nature. It is tortuous in nature. Please keep that in mind. Whenever a artery supplying any organ, if it is tortuous in nature, that means that particular organ is moving. Another example is spleen. I hope you have studied about the splenic circulation. Okay, so in that you have studied that splenic artery supplying the spleen, which is tortuous in nature. Same in case of uterine artery, which is tortuous in nature, because the uterus is expanding during the time of pregnancy. Okay, so that's why the artery is tortuous in nature. Okay, now the two uterine arteries branch of the anterior division of internal iliac artery. Okay, and it is also supplied by the ovarian artery. So this ovarian artery and the uterine artery, they will anastomose on the lateral border of the uterus, and then they will supply the various part of the uterus. Along with that, they also supply some part of the fallopian tube, and they supply the vagina also and the cervix. As you can see, this is the internal iliac artery. So this is the uterine artery, which is tortuous in nature. See, this is tortuous in nature, and this is the ovarian artery. So they are anastomosing on the lateral border, and then they are supplying the various part. Okay. Now, in case of venous drainage, the plexus is formed, which is draining into the uterine, ovarian, vaginal veins, and ultimately they will drain into the internal iliac vein. Okay. So that is the blood supply. So today we have discussed up to the blood supply of the uterus. In the upcoming class, next class, that means the next week, first the lymphatic drainage, followed by the applied importance of the uterus. Okay. I hope you have heard about the infertility and all, right? So in the next class, we'll be discussing what are the causes of infertility. If it is there, what are the different investigations done? Then HSG, hysterosalpingography. Okay, so those things we'll discuss in the next class. Okay, okay, thank you.